Hep C is a communicable virus that can be transmitted through blood-to-blood contact, such as needles and sexual contact. The virus can survive outside the body for up to 3 weeks, making it very hazardous. Hepatitis C is a leading cause of chronic liver disease and cirrhosis. The origins of the virus are unknown since the oldest blood samples are 50 years old. In 2013, in the United States alone, about 30,000 new cases of Hep C were reported, and about 3% of the world's population currently has the virus.
Many individuals that are infected with the hepatitis C virus often do not show immediate symptoms. If they do have acute symptoms, it's usually around 2 weeks to 6 months of when they were originally infected. A list of these symptoms can include fatigue, nausea, stomach pain, dark-colored urine, discoloration of the skin, also called jaundice, fever, or muscle aches. Once hepatitis C virus damages the liver, many individuals will experience chronic symptoms. A list of these symptoms include bruising easily, bleeding easily, swelling of the legs, fluid accumulation in the abdomen, also called ascites, confusion, drowsiness, and slurred speech, and the combination of those 3 symptoms is referred to as hepatic encephalopathy. Hepatitis C often causes constant inflammation of the liver. Once this inflammation causes scarring and permanent damage, it's referred to as cirrhosis. Hepatitis C is one of the leading causes of cirrhosis. According to the CDC, for every 100 individuals infected with the hepatitis C virus, between 5 and 20 of those individuals will go on to develop cirrhosis of the liver. The hepatitis C virus life cycle is not completely understood. Scientists have proposed a sequence of events where the virus binds to, enters, hijacks, and then exits the cell of the liver. This sequence of events starts with the binding of the viral particle to the outside of the cell. At least 4 different proteins are needed for this binding that have been identified so far. The viral particle is then taken in by the cell via endocytosis. Once it's inside the cell, the protein coat dissolves, and then the RNA is released into the liver cell. The viral RNA takes over the liver cell machinery to make viral proteins. Protease enzymes from the hepatitis C virus and the infected liver cell cut the protein strands into various viral proteins. Then hundreds of copies of the hepatitis C RNA are made by the polymerase enzyme within the liver cell. The capsid, or the protein shell, then forms around the copies of the hepatitis C RNA to make new viruses. These viruses eventually find their way near the outside of the liver cell and exit the cell via exocytosis.
Hi, I'm here at Achillion Pharmaceuticals to talk about previous drugs that were used to treat hepatitis C. 2 drugs that were very common to treat hepatitis C were ribavirin and interferon. Unfortunately, ribavirin and interferon used to cause side effects such as nausea, vomiting, fatigue. In new drugs like Carvoni, ribavirin and interferon are not present. Ribavirin and interferon are drugs that are not specifically targeted to hepatitis C. Therefore, ribavirin and interferon only had about an 80% cure rate. Carvoni is a drug targeted specifically at hepatitis C, causing it to have about a 95% cure rate.
My name is Christopher Marlor. I'm a scientist at Achillion Pharmaceuticals. I wanted to show you a machine called an HPLC, which stands for High Pressure Liquid Chromatography, which is a system we use to look at the purity and stability of our potential drugs. So we put the sample in here. Oops. And then the sample will get injected and go through this chromatography column and separate out so that you'll get a profile that looks like this. So as you can see here, as you get one peak, the compound is very pure. This is our liquid nitrogen container where we keep our cell lines. We have many different mammalian cell lines, eukaryotic cell lines to run our assays in, infect cells with virus, and grow cells. This is one of our mass spectrometers, our newest machine. It's a SciEx, it's called a Q-Trap 5500. What this machine does is, it's a mass spectrometer, so it will actually be able to detect an exact mass of a chemical or a compound in a very complex matrix like plasma. So what we do is we can take plasma samples from animals that we've dosed with our compounds, and we can then quantitate the amount of drug in the plasma samples. So before it goes into the mass spectrometer, it goes through a high pressure liquid chromatography system, which is all this.
Here you can see one of the compounds being synthesized before being tested against the hepatitis C virus.
At Achillion, we have softwares where we can get the three-dimensional structure of our compounds right here, and we can model or fit the structure of our compounds into specific HCV protein structures, which is this. So these are the amino acid backbones of specific proteins, and then here's our drug here. You can see some of the phenyl rings.
Recent scientific advances have allowed for a new drug regimen to be developed that does not require interferon, ribavirin, or any other complex regimen of drugs. As previously mentioned, this new drug, Harvoni, is a pill that you take once a day and has had a cure rate of up to 99% in patients who took this medication once daily for a 12-week period. In a study of 865 patients with genotype 1 Hep C and no prior Hep C treatment with or without advanced liver disease, 99% or 210 out of 213 who received Harvoni once daily for 12 weeks were cured. In a separate study, 647 patients with genotype 1 Hep C with no prior Hep C treatment and without cirrhosis, 96% or 208 out of 216 who received Harvoni once daily for a 12-week period were also cured. Patients with cirrhosis had a lower chance of a cure rate, but not significantly lower. The chances of cure rate were about 95% as compared to those of no cirrhosis who had a cure rate of 97 to 99%. Cure rate simply means that there is no Hep C virus detected in the blood within a 3-month period after completing the medication regimen. It is our goal here at CELE Health to provide our patients with Hep C awareness as well as to provide them with the most up-to-date cures.
Innovate.
Educate.
Celebrate.
CELE Health, finding innovative strategies for hepatitis C prevention, research, and treatment.